Good morning, everyone. So today we will take you through the ENT physical examination. So first, we're going to do the ear examination, which includes inspecting the auricle, the otoscopy, and then the tuning fork tests, such as the Weber test, Rene test, and the Schwabach's test. Afterwards, we're going to do the anterior rhinoscopy using the nasal speculum. And then after that, we have the examination of the oral cavity and the oropharynx using the tongue depressor so that we can check for all the subsites of your oral cavity and your oropharynx. And then finally, we have the neck examination wherein we palpate all the levels of your neck to check for swellings and other abnormalities. So today we're going to take you through each exam, what materials you need to use, how to use them, and then how to go about the actual examination. So let's start.
Before anything else, it's important to establish rapport with the patient and make them feel comfortable. After establishing rapport with the patient and taking a complete and thorough history, the exam can now be done. Make sure to explain the exam to the patient before doing it.
I'll start with the ear examination first, alright? But before that, are you seated comfortably?
Yes.
Okay, and if you have any questions during the exam, you can tell me. So first, let me check your auricle to see if there's any abrasions or any lesions or tenderness.
Examine the auricle and its surroundings. Note the shape and color and if there are any swellings, lesions, and deformities. Check if the patient has tragal tenderness by manipulating the tragos. Do this for both ears. Hold the otoscope like a pen or a hammer and make sure the light is on. Pull the ear superiorly and posteriorly to straighten the canal. And then slowly and gently insert the otoscope just before the bony portion of the external auditory canal. Examine the canal in the eardrum, making sure that the patient isn't feeling any pain. For the Weber test, you place the tuning fork on any midline structure and ask where the sound can be heard from, the right, the left, or both. For the Rene test, you present the tuning fork on the mastoid process and instruct the patient to tell you when the sound is gone. And then you do the same thing around 1 cm lateral to the EAC and compare where the sound is heard longer. For the Schwabach test, you place the tuning fork on the mastoid process of the patient and then ask the patient to tell you once the sound is gone. Afterwards, you place the tuning fork on your own mastoid process and compare.
Okay, so here are your results for your ear examination. So your ear canal is pretty normal. The tympanic membrane is translucent and gray, and the cone of light is very visible, which indicates that it's normal. So, are there any questions or clarifications on that part? No. For the hearing tests, for the Weber test, both of them the sound was heard equally on both sides. For the Rene test, your air conduction was greater than your bone conduction, which indicates that it's normal. And for your Schwabach, we had approximately the same amount of time when we heard the sound, so that indicates it's also normal. Okay.
Ask the patient to lean forward and look a bit upward. Your headlight must be placed on your less dominant side to avoid hitting the light once you do the rhinoscopy. Hold the speculum properly as shown. Make sure the speculum is inserted with the blades closed. Insert the speculum just until the nasal vibrissae and then open gently. Be careful not to stretch the ala too much as it can be painful for the patient. Afterwards, withdraw gently with the speculum still partially open to avoid hair avulsion.
So Doc, how was my results?
Well, Mr. Ford, it seems that your results were actually kind of good. When I checked your nasal septum, there were no signs of any deviation, perforations, or any sort of active bleeding. When I check the floor, there are no active bleeding as well, and there is no sign of congestion. For your turbinates, there is no sign of congestion, but it could be normal even if there are congestions. And as I've said before, there are also no sites of bleeding.
For the oral cavity exam, ask the patient to stick out their tongue. Inspect all subsites including the lips, mucomucosa, upper and lower alveolar ridge, floor of the mouth, anterior 2/3 of the tongue, retromolar trigone, and hard palate. For the oropharyngeal exam, don't ask the patient to stick out their tongue. Use a tongue depressor only up to the anterior portion of their circumvallate papillae to avoid triggering the gag reflex. Inspect the tonsils, base of the tongue, and posterior pharyngeal wall.
Okay, so how are you feeling?
I'm feeling good.
Okay, good. Did you feel any discomfort at all?
None at all.
Okay, that's great news. So here are your results. As you can see, your oral cavity is all fine. There are no problems or any lesions or abnormalities.
Okay, I'm glad to know that everything's normal.
Oh, you're welcome.
First, inspect the neck. Look for any masses, swelling, skin lesions, drainage, or deformities. Afterwards, gently and carefully palpate all the levels of the neck, starting from 1A to 1B, 2, 3, 4, and 5. Be careful not to press too much on the neck. Palpate the anterior neck including the thyroid gland. Put both thumbs on the side and not on the center of the trachea just under the cricoid. Ask the patient to swallow, and this will make the thyroid gland slide under your thumbs.
So, Doc, is there anything wrong with my neck?
Oh, don't worry, Homer. Everything's all good. Palpate your neck and there are no masses, there's no swelling, and nothing wrong. Here, I made a drawing of your neck, of different lymph levels, the different levels of the lymph nodes, and there's nothing not normal. Everything's normal.